Hello, everyone, and welcome to Dissociative Disorders. This is chapter 24. So in chapter 24, we're going to talk about self-concept, right? Who are you? What makes you you? Low self-concept, maladaptive behaviors. High self-concept, adaptive behaviors. Your self-concept is that everything that makes up you, your body image, your self-esteem, your self-ideal, personal identities, role performances, and it's influenced by many factors: culture, society, right? Your parents, siblings, other people in your life and how they interact with you, and your experiences. People behave in a manner based in large part on their self-concept. Who you are and what you do is going to change based on your idea of who you are, right? And just like everything, it occurs on a continuum. Our self-concept is going to change over time, and small changes are normal based on what goes on in our life. Healthy personalities, we're effective, we can perceive and function in the world. We are able to cope and feel good about living, right? As we've said all semester, mental health problems arise when these skills are not learned, and negative self-defeating behaviors become our common coping mechanisms. Throughout the lifestyle, right? Erik Erikson, trust versus mistrust in infants. That's when they learn to trust. They learn what's acceptable. Toddlers are going to push the limits. They need consistent limit setting, and they're going to get positive reinforcement or negative reinforcement from their parents. School-aged children, they start to see that things are different. They learn new rules. They learn things outside of their home environment. Children who are bullied in school can begin to develop that negative self-concept, and that's going to carry them throughout life. In early adolescence, teen years, their idea of self is going to be challenged repeatedly. Why? Relationships, confidence, sexual identity, body image, and that's just a few. It's going to keep changing. In adulthood, when you have a strong positive self-concept, you're more likely to try new things, get a new job, strike out and try something new, get in a new relationship. Adults with low concept, right, low self-esteem, are going to view themselves as inadequate or incapable. And there you see decreased productivity and independence, failing health, right, death of a loved one, and all sorts of those things can challenge all of these at any point in time. In the older adult, many things are going to happen that are going to threaten self-concept, right? We can help enhance our clients' self-worth through listening and showing concern. So the meat and potatoes of this chapter is the dissociative disorders, right? What is disassociation? That's daydreaming, right? At any point in time, it's a way to cope with our emotions by drifting away mentally, right? So spacing out when you're fighting with your significant other, right? Driving home from school and all of a sudden you're like, how did I get home? Identity diffusion is where you can't mix your childhood identities with your adult personality, right? So again, disassociation, normal, such as a mini escape or daydreaming, and then it progresses to a mental illness when we talk about dissociative identity disorder. So characteristics, they're becoming more common in the United States. Two sources, amnesia or fugue, and that's problems with the memory or conscious, and dissociative identity disorder, hit the button too soon, is one's identity, right? Dissociative identity used to be multiple personality. Depersonalization and derealization. It's your response to severe anxiety associated with the blocking of awareness and fading reality. We talked about both of these with schizophrenia. It could be a symptom, right, commonly associated with other mental disorders. Depersonalization. My body's not my body anymore, right? You feel like you're floating outside your body, just watching your body move through time. Derealization, a detachment from your surroundings. So it's a little bit different. You kind of just feel like you're a bubble floating through space. Dissociative amnesia is amnesia. It's a memory loss. That It's because of trauma. Something traumatic happens. There's a house fire. Someone is raped, robbed at gunpoint, and all of a sudden they can't remember personal information that you would not expect them to forget. Dissociative fugue. Something traumatic happens and all of a sudden you're finding the patient halfway across the country. Fugue is always associated with unexpected travel and with an inability to recall the past. Sometimes you see it as dissociative amnesia with fugue. You can see the words combined. But if there's any type of travel in the patient, expect to see a fugue. There's a traumatic event, right? This is fight or flight to the extreme. Something traumatic happens and the patient disappears across the country. They have a new family, they set up a new house, they got a new job, and they have no idea about their past life. Dissociative trance disorder are kind of cultural. It's voluntary, no distress or harm to the individual. They don't lose their identity, right? Think of it as like hypnotism. They just kind of black out, right? They drift away. Dissociative identity disorder. 2 or more identities or personalities within another person. Sybil, Split, Fight Club, all of those are examples, in movies about dissociative identity disorder. Usually what happens is each personality is unique, representing a different point in time in that person's life. Right? So in this video we watched, and I'm not going to play it because I think her voice is really annoying. Something happened, right? The voices talk about, I'm here because I can tell what daddy did to us. So to protect that individual, to protect her brain split into multiple pieces and created other friends to live inside her head with her. Right? She had the big, strong muscle guy, right? I think his name was actually Muscles, who would come out at certain times. And it's a defense mechanism, usually started in childhood, to deal and cope with some type of trauma. The brain cannot process trauma, so it makes other people who will handle the trauma, not your individual. With dissociative identity disorder, right, what you're going to see is a patient who maybe isn't responding to the name, right? They've been on the unit, you've been calling them Mary, and all of a sudden they're like, I'm not Mary, I'm Fred. And they're going to switch back and forth between age, gender, right? One time we had the patient who was mobile and was able to walk, and all of a sudden they were someone different and they needed a wheelchair. Treatment for dissociative disorders is long-term therapy in an outpatient setting. You need hospitalization only if there's safety. Anger, aggression, violent towards self or others. Sometimes, especially in dissociative identity disorder, one of the personalities is trying to hurt one of the other personalities. Individuals struggle to function because of memory loss and switching back and forth. Medications are going to be based on symptoms. Treatment, we're going to do a whole bunch of stuff. This honestly is just a bunch. Trauma work and therapy is the most important in this one. Time, patience, and hard work, everyone is going to integrate. And hopefully we'll get everyone to a spot where they can cope with life stressors effectively. Nursing interventions, assess the client. Nursing diagnoses can be related to self-concept and the identified problems. It could be self-harm still. We're going to help the patient look at their situation and related feelings within an environment of safety and support. Care is complex and time-consuming and challenging because it's long-term trauma work. This is not an easy fix. It can be rewarding in the long run. Okay, that is it for the chapter. It was a super short chapter. If y'all have any questions, please let me know. Have a good night, y'all.